Looks like we're just missing Morgan and Kathy.
Is it just my imagination, or do I hear Jane?
Oh, she's in the background of mine.
Oh, okay.
Yeah, she's on the phone in her office.
While we're waiting, can I ask Jimena a question?
I don't see her on the call. Yeah.
Oh, I thought she was there. Okay.
Sorry, yeah, Morgan and Felicia are back. I don't see Jimena yet. Yep, there's Jimena back. You're getting connected. Yep.
Oh, yay. Back. Sorry. So sorry, everyone.
Hi, Jimena.
First Zoom meeting, and we hit a little glitch. So sorry about that, everyone.
That's okay.
It was going so well.
I know. So well. Okay.
It'll happen.
All right. So we were discussing the resolution. And I know Felicia had chimed in about the plans with the Board of Commissioners. So I didn't know if there was any more discussion. It sounds like there's a little bit of editing for the resolution based on your feedback. I think, I know that when we talked with the executive, or when I talked with the executive committee, there was a sense of wanting to, sort of get this out quickly, be able to finalize it quickly. We do have the ability to approve things via email or electronic approval according to our bylaws. So I would be happy to make revisions and circulate hopefully a final draft for approval via email, if that's agreeable with everyone. Okay, given that the Board of Commissioners meeting is on Wednesday next week, if I commit to getting this to you by early Monday morning, would you be able on Monday by the end of the day to review and cast your vote? Does that seem reasonable? Okay, all right, that will be our plan then. Thank you so much.
All right, moving on. Our next item of new business is CARES funding.
Yeah, so Jennifer actually mentioned this in her budget presentation, but just wanted to explain kind of the CARES funding situation. As Jennifer mentioned, there are some counties that have larger populations who have gotten CARES funding directly. And so you may be seeing and reading about all the fabulous things that Oakland County is doing and Wayne County is doing. And a lot of that is because they got, hundreds of millions of dollars in CARES funding. the CARES funding that was just released through the most recent legislation that Jennifer mentioned is really just a small part of the CARES funding that Michigan has. And this is funding that has to be spent by the end of the year. So while we're glad to see that there's some initial funding coming to counties, we know that there's a lot more funding that the state of Michigan has. And the challenge is that the state of Michigan has been holding on to that funding because they are waiting to see what additional funding they get from the federal government, given the tremendous budget deficits that the state of Michigan is facing. And so fortunately, I have in my former life at the HIV/AIDS Resource Center, our board chair was Chris Kolb, who is now the budget director with the governor. So I put a call into him to get an update on the CARES funding. And I know that they're continuing to work on getting more funding released to the county. They're also at the state level really advocating with the federal government to be more flexible in how the funding can be used, and also to perhaps extend the deadline by which the funding has to be spent so that it would go beyond the end of this calendar year. So more to come. We certainly hope that more CARES funding will be coming our way. And then, as Jennifer mentioned, we're getting sort of last minute information about funding that might be coming to us from the state. And so yesterday on a call with the Michigan Department of Health and Human Services, it does seem that they are going to be distributing funding to support local health departments' case investigation and contact tracing efforts. That's very good news. They have various tiers of funding based on the size of the health department, the number of cases that jurisdictions have had, and we may get notification of that funding as soon as next week. So the good thing is that the funding that the state is looking at allocating to local health departments is on a 30 month funding cycle. So they are really looking at providing funding in a more long-term manner to sustain not only kind of the current response efforts, but also to help prepare for a second wave, and also when that vaccine becomes available, really kind of thinking long-term. So just wanted to let you know, we'll be sure to keep you updated, but hopeful that we'll hear soon about that additional funding from the state. Any questions about that? Okay, and then the last thing that I wanted to mention, although certainly another kind of potentially big issue, Commissioner Andy Labar and Commissioner Katie Scott have been spearheading an effort to look at a new millage that would support public health and senior services. Now, there's been some ongoing work for, I think, probably more than a year now, looking at a senior services millage and creating a senior commission at the county. So I think that work has been going on for quite a while, and there's a group that's been organizing that. I think that the commissioners saw this as an opportunity to include public health, given not only kind of the current situation, but in general, the ongoing kind of resource challenges that we've had as a health department. And so it's a little bit on a fast track. We've provided some initial information to Commissioner Scott and Commissioner Labar. I don't know if you saw the last Board of Commissioners meeting, but Commissioner Labar introduced some draft language. It was not voted on. It was not really an official part of the agenda, but I think their plan is to make it more officially reviewed and discussed at the Board of Commissioners meeting next week. So you may want to tune in on Wednesday. If there is movement forward on this, the language would have to be finalized by the 25th of July, which is a month away. The language would have to be finalized by the 25th of July in order for it to be ready to be put on the November ballot. And millage would be a half mil that would be split 50-50 between public health and senior services. And so I just wanted to let you know that this is sort of being discussed by the Board of Commissioners, again, being led by Commissioners Scott and Labar. I think they feel fairly confident that they would have enough votes to move it forward. And of course, of course, it would be wonderful as far as, funding for the health department, but I also know that we're facing, very challenging economic times, and not sure as much as, we're seeing the importance of public health, not sure what the appetite is among voters to approve an increase in taxes. So, and if Felicia is still on, she may have more to add about that, but happy to answer any questions, and certainly we'll keep the Board of Health members informed if there's particular advocacy or action that you might be able to take depending on how this goes.
And man, I'll just mention the foundation's been involved with the group working on the senior millage, as you know, for the last year, and we've been providing funding for them to do focus groups to understand the appetite, and we're supportive of a split millage. I know not everyone in that community coalition around the senior funding wants to necessarily share that pot, but and the other piece I'll mention is, as I mentioned to you, I'll advocate with Commissioner Labar that public health has a designated seat on the senior commission as well. It makes a lot of sense to us, and hopefully that can help make sure that you have a seat at that table as well as it's being created, since they're obviously so interconnected.
Yeah, and that's a lot of the information that we've provided, is not just about sort of the needs of the health department, but also the connection of the work that we do in public health to healthy aging. And also looking at it as an equity issue as well, since we know that we have significant differences in life expectancy between whites and people of color. So that's also another aspect that's really important to address.
Any other questions? All right. Anyone like to bring up any new business for the next meeting? Do I have a motion to adjourn?
Well, before we adjourn, I'd like to ask Jimena a quick question, if I might.
Of course, Leon.
First of all, hi.
Hi.
Good to see everyone. Jimena, what's your relationship like with the Monroe Health Department? Do you have any relationship ties with them out there?
Yeah, well, so I am pretty regularly participating in meetings with health officers from around Michigan. And so I know their health officer. We've worked together on some things. So certainly know the health officer. And then also I mean, you probably remember that our CDC associate, Lizzie Adeleye, she worked on an opioid awareness campaign. And that campaign was used by all the counties in the PIHP region, which includes Monroe. So we worked with Monroe, and also I believe they have a substance use disorder coalition community group that we worked with as we were developing that campaign. So those are kind of the connections that come to the top of my head around Monroe.
Okay. All right. Thank you. I'll probably be back in touch with you about that at some point.
Feel free to reach out to me, of course.
All right.
And Jim, if you wouldn't mind, before we adjourn, I just wanted to kind of take this opportunity to, well, thank all of you for your support and your feedback and your challenges. I really appreciate that. We are a high achieving health department, but we know that we can always improve. So thank you. Also, it's great to see all of you, and it's been a while since we've met. But please remember, COVID-19 hasn't gone away. And I hope that as members of the Board of Health, you will continue to help reinforce prevention messages. So when you are in an enclosed public space, please do your part, wear a mask or face covering. If you're out in public and you can't maintain 6 feet of distance, please put on a mask or a face covering. And remember, good hand hygiene, wash your hands often and well for at least 20 seconds. Use hand sanitizer if you're not able to wash your hands. And please do everything you can to protect each other, protect your loved ones, and stay connected. And we really appreciate your support in reinforcing those important messages. I hope everyone stays safe and stays healthy and well. Thank you all.
Have a nice weekend, everybody. Do we have a motion to adjourn?
So moved.
Seconded?
Support.
Second.
Do we really need a roll call now?
All in favor?
Aye.
Aye. Any opposed? We're adjourned. Thank you all.
Bye,
Thank
everybody.
you, everyone.
Mhm.
Thanks, Ross.
Thank
Bye.
you. Luckily, the glitch got fixed pretty quick.
So what was that? What happened?
Someone
I-
else. Oh, what
Go
you
ahead.
say? Someone else started a meeting on the account. You can only have one at a time.
Oh.
And I think they probably didn't see it because this was a webinar and that was
Oh, gotcha.
a lesson
Okay.
in limited
Yeah.
resources.
Yeah. Well, you guys, I mean, I can't thank you enough. I know we had a glitch, but overall, I think it went really smoothly. So thank you for all the prep work you did. Really appreciate it.
No
Yeah.
problem.
Now go and enjoy your weekend,
Right. You too.
right? Thanks, you guys. Take
All right.
care.
Thank you.
See ya.
Bye-bye.